infectious diseases are influenced by climate change. Okay, hopefully that has fixed things. All right, so again, the interplay between all of these factors is really complicated, and I'm not going to spend too much more time talking about that. Similarly, the transmission of infections is incredibly complicated as well. So every microbe that can cause a human infection has its own preferred survival and growth conditions. So for example, viruses need to be within a living being to reproduce, and however, they can survive with variable amounts of time outside the body. Other infectious microbes, so just bacteria, fungi, or parasites, can need a living host, but may survive in the environment. Some prefer to be in the water, some in the soil, some in the air. Many infections are carried by animals or insects. At the end of the day, humans acquire infections through one of three general methods. Either we inhale them into our lungs, we ingest them, or we have exposure to bodily fluids of our mucous membranes, or we come into skin contact or have some sort of skin break, which can include an injection from a bug bite. And in this way, infections are spread from animals, from other people, and from the environment to humans. And again, the interplay here is very complex. And when you start to look at this interplay and all of the different pieces that are involved, you can maybe start to see how climate change can affect these relationships. So kind of taking a real bird's eye view, there's a systematic review that was done a few years ago looking at how is climate change actually affecting the infections that cause diseases in humans. They looked at a total of 286 pathogens and found that only 9 of them had a decreased risk associated with climate change. However, 78% of the infections that they looked at were aggravated by climate change in one way or the other, whether that's from changes in humidity, changes in temperature, etc. So on the whole, climate change is driving exacerbation of infections. So as I mentioned, the kind of intermediate vectors do play a major role here. So I wanted to take a good amount of time to talk about vector-borne diseases, specifically those spread by mosquitoes and ticks, although acknowledging that there are also infections spread by many other insects, fleas, flies, and mites. So when it comes to mosquito-borne infections, there's 3 major genuses of mosquitoes that cause human infections. On the far left, we have the Aedes mosquito, which transmits the tropical infections, so dengue, yellow fever, chikungunya, Zika. All of these cause people to develop fevers and rashes and feel very unwell. Culex mosquitoes can transmit a variety of infections that can cause brain disease, encephalitis. And then Anopheles is the genus of mosquito that transmits malaria. So as I mentioned, Aedes transmits the kind of tropical diseases. Each of these can have its own kind of unique character. Dengue and yellow fever are 2 that we worry about the most because they can be fatal. We don't see a lot of ADs or the diseases transmitted by ADs here in Montana or also in Boston. However, our projections show that we are likely to see more. So this animation, let's see if this will work. It shows how the habitat is likely to have 80s is projected to increase to the point where by 2080, we'll be able to see these tropical diseases as far north as Canada and as far south as the tip of Africa and towards the bottom of South America. So these diseases that we think of as tropical now, as our climate warms, are going to become diseases that are just diseases that we all see. And we are already seeing the starts of this. So in 2025, there were actually 2,500 cases of dengue in the United States. The vast majority of these were either in people who had traveled to tropical areas or from Puerto Rico. However, for one of the first times recently, we also have been seeing cases, there were some cases in Florida. So we're starting to see kind of the northward creep. We're also seeing numbers going up over time. So even though most of the cases that we see in the United States are acquired abroad, we are seeing more and more cases being acquired abroad as the prevalence of this disease is rising even in the areas where it's already found. So as I mentioned, yellow fever is the other infection that we worry about a lot. It can have a second phase after the initial illness and that has a really high fatality. This disease actually played a really large role in the history of the Western Hemisphere. I could also give an hour-long talk on that. But there were epidemics throughout the 1600s and 1800s in the United States. And the last major outbreak was in 1905. And the reason that we don't see it here anymore as much is because we've done a really good job, or at least we had done a really good job with mosquito control. So there were really wide efforts for covering and treating standing water, fumigation, and then we developed a vaccine in the 1930s. And between all of these, we're able to essentially eradicate yellow fever in the United States for now. As it stands currently, however, yellow fever is not eradicated worldwide. It's found in sub-Saharan Africa and also in South America. And actually, recently, there has been a surge in cases in South America, such that there is actually a CDC active travel notice to people traveling to South America because there's so much more yellow fever there than there typically is. So vaccination is recommended for travel to these areas. So then there's the mosquito-borne diseases that are transmitted by the genus Culex. These are the viral encephalitis or encephalitides. So these cause fevers, confusions, seizures, coma, and even death. You've probably heard of West Nile virus. This is the most commonly reported mosquito-borne disease in the United States. Most cases occur between July and September. There's also lacrosse virus, which is the most common in children. This is mostly in the southeast, and eastern equine encephalitis, which is the most severe and is found in my current neck of the woods in Massachusetts. The thing is, Culex is already everywhere. So the Culex mosquito thrives in temperate climates. So it's already found throughout the United States. We do see Culex transmitted diseases here in Montana. Looking back over at the last several years, even in 2025, they have been detecting West Nile virus in either mosquito pools or in horses, and there have been cases of human disease, including human deaths, most recently in 2023. The last major genus of mosquitoes to think about is Anopheles, which is the mosquito that transmits malaria. Malaria has about an 8% mortality and presents with untreated and presents with fevers, anemia, kidney damage, respiratory difficulties. We don't think about malaria very much here in the United States, but worldwide it remains a really major issue. 2 to 5% of all fatalities in the 20th century were related to malaria. In 2023, there were about 250,000 cases, 250 million cases. So we don't think about malaria very much here in the United States now. However, it actually was a major problem in the United States in the past. So malaria was endemic in the United States until the 20th century. And again, we were able to eliminate it via mass efforts During the 1920s and 1940s, these are actually sort of billed as like wartime efforts, which was part of what was made them successful. But there was big efforts in terms of improving drainage, eliminating reservoirs, using insecticides, and giving people drug prophylaxis. It was declared eradicated in the United States in 1951. However, just because it's eradicated does not mean that it can't come back. So there's at least one species of Anopheles mosquito that is capable of carrying malaria, found in 32 of the 50 United States. We also know that the ideal conditions for Plasmodium are 80 degrees Fahrenheit and 80% humidity, which is not the temperatures that most of the United States see now. However, are the temperatures that we are trending towards. We do see about 2,000 imported cases per year. And actually, in 2023, we actually had the first endemically acquired cases in over 20 years. So there were 10 cases that were acquired locally in Florida, Texas, Maryland, and Arizona. So we actually are starting to see, Arkansas. We are starting to see malaria being transmitted within the United States. So people acquiring it without having traveled. We also know that in terms of national surveys of mosquito control agencies, we are not functioning at full capability currently. Only 8% were classified as fully capable. Half of mosquito control agencies in the United States did not even perform routine standardized surveillance. What that basically means is that we don't actually necessarily have a great handle on how much malaria there is or could be in the United States, and it could already be here way more than we're aware of. So, kind of zooming out a little bit, what we know about all of these mosquitoes and climate change is we are seeing rising temperatures. Warmer winters lead to year-round survival for mosquitoes and also allow them to survive at higher elevations. Increasing humidity also improves survival. We are seeing more human-aided dispersal as humans kind of bring mosquitoes with them as they travel and do trade. We are seeing changes in land use and urbanization, as well as rising coastlines of brackish water and standing water after extreme weather events. All of these increase the risks associated with mosquitoes. And as I've been saying, we are actually already seeing these events. So in 2015, there was a Zika outbreak that was associated with a severe drought during unusually high temperatures. We see spikes of malaria after severe flooding in Pakistan and Mozambique. And overall, we're seeing malaria at higher and higher elevations worldwide. So it used to be considered to be a disease that if you were up in the mountains, you wouldn't need to worry about it. But now the mosquitoes are able to survive at higher and higher temperatures. So what we can do about this, first, anytime you're going to be outside in an area that might have mosquitoes, which again, if you're considering Helix is everywhere, using regular use of EPA-approved insect repellent or DEET. There's a whole list of other insect repellents that can be used. Just make sure that you're picking one that's approved by the EPA website, because there's also a lot of unapproved ones that have questionable benefits. If you're going to be traveling to a part of the world that has yellow fever, dengue, some of these diseases that we don't currently see in the United States, I recommend consulting with a doctor, ideally an infectious disease physician, about free travel to consider getting like vaccination against yellow fever or malaria prophylaxis. When traveling or in areas where there's a lot of mosquitoes, using full covered clothing, sleeping nets, and making sure to be very conscientious about removing or covering any standing water. From a systems perspective, mosquito control measures could include removing standing water, using insecticides, and particularly focusing around international airports, because we know that mosquitoes can travel in the cargo holds of airplanes, and that this can be a way that mosquitoes can spread from one area to the other. Also supporting public health systems and improving the surveillance. And like I said, our mosquito surveillance right now is kind of woefully underfunded and underdone. And so investing in that would be helpful. Similarly, if you're a healthcare provider and you're seeing cases of any of these, please do report them, because a lot of our current surveillance system is based on reporting. And then, of course, overall, decreasing greenhouse gas production and addressing climate change as we can. So that was about mosquitoes. Ticks also can carry a wide variety of illnesses. I am going to focus on the one that four in the on the left side on the top. So Lyme disease, which I'm sure everyone has heard of, caused by bacteria, which can cause fevers and rash. It can cause heart problems and chronic neurologic or joint problems. There's Rocky Mountain spotted fever, which is also caused by a bacteria, which can cause fevers and rash and has a really high fatality rate, especially if it's not diagnosed or treated. Tularemia, another bacteria which is spread by ticks, can cause a variety of diseases. And again, it's a really high fatality rate if it's untreated. So the really important thing about these diseases that have a high fatality rate if untreated are that we need to recognize them. And so if these diseases are spreading in areas where people are not aware of them, they won't be recognized and people won't be treated. And then lastly, is in this part of the world, or in this part of the country, we have Colorado tick fever, which is a virus, which causes a febrile illness, which can have really prolonged weakness and fatigue. So just like with the mosquitoes, different ticks transmit different diseases, and different ticks have different areas of distribution. So there is the black-legged tick, Ixodes. This is the tick that transmits Lyme, also transmits Babesia, Anaplasma, and a few others. We have a lot of this in the Northeast and in the Midwest. There's not a ton of it here in Montana currently. However, there are some black-legged ticks along the West Coast, and we are seeing their geography moving eastwards. There's the Lone Star tick, which is found predominantly in the Southeast, although these days as far north as Maine. Then more in this neck of the woods, there's Dermacenter, which are the Rocky Mountain wood tick and the American dog tick. These transmit Rocky Mountain spotted fever, tularemia, and Colorado tick fever. And then lastly, there's the brown dog tick, which is found worldwide, which can transmit, or sorry, countrywide, which can transmit Rocky Mountain spotted fever. So what are we actually seeing? So these are the reported cases. And of course, with reported cases, you have to remember that this is probably just the tip of the iceberg. Probably many more cases that are not diagnosed, many more cases that are diagnosed and not reported. Up in the Northeast, you see we have a ton of Lyme disease, a ton of Anaplasma. We have a lot of babesiosis, as well as some Ehrlichia. In Montana, what you have is that there's about 8 cases of that Rocky Mountain spotted fever every year, 5 cases of tularemia every year, 4 cases of the tick fever every year, and then there are rare cases of tick-borne relapsing fever. Lyme disease diagnoses are common, but they're almost always acquired out of state. However, we are now identifying those black-legged ticks that I said were spreading east from the West Coast in Montana. So it's likely only a matter of time before somebody who has traveled to an area that has Lyme, picks up Lyme, comes back to Montana, gets bitten by one of these black-legged ticks, and then we'll start having transmission in Montana. And just like with mosquitoes, our public health systems are not doing the surveillance and control that they ideally should be doing. This is really an issue of just time and funding. It's not that they don't want to do this surveillance and control activities, but when looking at public health departments kind of around the country, only 25% of them conduct surveillance, and only 4% of them do tick control activities. So again, we're really woefully unprepared and not really doing very. So kind of summarizing, similar to the mosquitoes, what we're seeing is that warmer temperatures, milder winters, increase tick survival, accelerate the development. They lengthen the season during which ticks can transmit diseases. They also are increasing the populations of reservoir hosts. So for example, we've seen a very large recovery of white-tailed deer populations in the Northeast, and because they can be involved with the life cycle of the tick, we've seen a corresponding increase in Lyme. Also changes in land use and vegetation and travel. So we're seeing the rates of tick-borne illness rising. So globally, the seroprevalence of Lyme, which means if you check someone's blood, whether or not they have an antibody that indicates that they've ever had Lyme before, is about 15%. So about 15% of people worldwide have had Lyme at some point. Between 2010 and 2018, Lyme diagnoses increased. In high incidence states like Massachusetts, we saw a 20% increase. In states that were neighboring high incidence states, we saw an 89% increase. And in low incidence states like Montana, there was a 48% increase. So we're seeing increases across the board. Again, similar to mosquitoes, we're also seeing the tick ranges increasing towards the poles and towards higher elevations. The mitigation efforts for ticks are similar to the mitigation efforts for mosquitoes. However, there's a few additional things to do. So of course, wearing the EPA approved insect repellent is helpful. When hiking or being near brush, wearing permethrin-treated clothes, light colors, ticks prefer dark colors, long sleeves and pants. I always tell my patients, if you're going to be going out for a walk, going out for a hike, like tuck your socks into your pants. It's not cool now, but if we all start doing it, maybe we'll start a trend. Um, Avoiding wooded or brushy areas and avoid brushing against vegetation. Oftentimes how ticks come onto people is somebody walks past a brush or some sort of vegetation and the tick kind of latches on that way. It's important to do regular tick checks and remove ticks with tweezers within 24 hours. It varies depending on the disease, but some diseases require the tick to be attached for a decent amount of time before they transmit. So Lyme disease is one of these, where the Lyme really doesn't start to transmit until the tick's been attached for like 48 hours, really, 24 to 72. So if you're doing regular tick checks and removing any ticks under 24 hours, you're unlikely to acquire Lyme, even if you're in a Lyme endemic area. We do also give antibiotic prophylaxis after ixodes tick bites in Lyme endemic regions. So this is not something I recommend here in Montana. However, if you were traveling in a region in the Midwest, in the Northeast, that had a lot of Lyme, and you did get bit by a tick that you could identify as ixodes using the internet to kind of look at pictures, we would give people a dose of doxycycline. Pets can also be a way that people acquire ticks. So I see a lot of people who come in with Lyme disease, never had a tick themselves, but find ticks on their dogs all the time. And dogs can be treated with vet-approved tick prevention products that can decrease the likelihood. Similarly, managing the vegetation in one's home, making sure to mow, remove leaves, make sure there's not a lot of vegetation for ticks to be hiding in, and for people to be encountering ticks in. Their insecticides have been shown to reduce tick populations, but not really actually reduce disease incidence. So that one's a bit of a question mark. Supporting public health systems and surveillance is again really key. Here in Montana, the request is that you report any tick exposures to the Montana Department of Public Health. There's a website, there's a dashboard that they have on their website. So if you have any tick bites, any tick exposures, they request that you report them. Because again, they're very underfunded. Our public health systems and surveillance systems are very underfunded. We're really kind of reliant on crowd support at this time. So those are just a flavor of some of the vector-borne diseases. There are a bunch of other diseases that are transmitted between humans and animals. Some of these do include those, like I mentioned, the deer, white-tailed deer is part of the life cycle of the tick, and the reservoir for the Lyme disease is the white-footed mouse. But there are some diseases that are transmitted to humans via other ways. So from eating animal meats or byproducts, contact with animal feces, contact with rodent urine can transmit a couple of diseases, particularly leptospirosis, and inhalation of shed or exhaled particles can transmit hantavirus as well as influenza virus and coronavirus. So about 60% of the emerging infectious diseases that we see worldwide, where the numbers are going up, are related to zoonoses, and this likely has to do with increased human-wildlife contact, deforestation, habit changes leading to more and more spillover events. So our climate changes are affecting animals, and that is affecting the diseases that transmit between animals and people. So there are a few diseases that are transmitted by rodents. So leptospirosis, which as I mentioned is transmitted by rodent urine, hantavirus, which is transmitted from inhaling particles from rodents, plague, which is transmitted by fleas, and then tularemia. And for all of these, we're seeing that climate changes expand rodent populations. So the warm, wet winters are good for the mosquitoes, they're good for the ticks, also good for the rodents. Heavy rainfall also can be good for rodents, and expanding human population means that we have more crops, more edible waste, which also is good for rodents. We then see that sometimes harsh weather conditions like heat waves, floods, can drive rodents indoors, which will increase the likelihood of them transmitting infections to humans. So one example that's relevant here in Montana is Yersinia pestis, or plague. So plague still exists. Some people don't know this, but the disease that causes Black Death is still found in the United States, including in Montana. So kind of looking back over the past 20 years, we see that in any given year, there's anywhere between 1 and 16 cases reported nationally. However, again, likely the tip of the iceberg. We see here that climate change affects not only the Yersinia pestis bacterium, but also the flea vectors. So just a couple of examples of how plague is affected by climate change. We know that a 1 degree increase in Celsius in spring temperatures actually results in more than 50% increase in the prevalence of the bacterium in the reservoir host. So it survives really well with warmer temperatures. We also see that flea densities on prairie dogs is inversely proportional to precipitation. So we actually do see plague outbreaks in prairie dogs here in Montana. And we tend to see outbreaks after droughts because that's when we see more plague or more fleas. We also see that climate change is likely shifting the plague risk regions north, which, as you can see from that map on the left, it's currently in a space that is the highest risk is in a space that's right down below Montana. So it's projected kind of up towards us here. So what can we do about this? Standard mitigation for rodent-associated infections. First, trying to control rodent populations, trying to limit access of rodents into our homes and spaces. So identifying rodent entry points and sealing with metal mesh, making sure not to attract rodents by storing food, including pet food and birdseed in rodent-proof containers, removing garbage regularly, cleaning areas that have been contaminated by rodent excreta. And this is really important because, like I said, both the rodent urine as well as the particles when inhaled can transmit diseases. You want to make sure you're using gloves and pre-wetting the entire area with a disinfectant and not just sweeping up dried mouse droppings, because that's a way that you can acquire hantavirus. Using traps, rodenticides, professional extermination, keeping any pet or feeder rodents away from wild rodents. And then community-wise, thinking about community sanitation and rodent control measures, particularly trash management is kind of real stable of rodent control measures, at least in the Northeast. And then again, because climate change is driving a lot of these changes, making sure that we're focusing on addressing the underlying climate change itself. The next method of disease transmission to humans that I wanted to talk about that's affected by climate change is the transmission of water and foodborne infections. So 1.4 million people per year die from diseases that can be attributed directly to the lack of safe water, sanitation, and basic hygiene. Diarrheal illnesses are the third leading cause of death among children under 10 worldwide. And we know that these water and foodborne infections also are worse in the setting of rising temperatures. So the annual temperature attributable excess deaths due to these kinds of diarrheal illnesses is projected to be between 10,000 and 75,000 by 2050 to 2065. So what happens is we see higher ocean temperatures. This leads to evaporation, which leads to increased atmospheric water vapor. We then see more severe weather events and flooding. With the higher temperatures, we also see increased pathogen survival and virulence. We see rapid urbanization, which leads to more housing with inadequate water and sanitation facilities. We see flooding. Flooding leads to sewer overflow, which also damages water source infrastructure, which means that people are getting more and more unsafe, potentially contaminated water. And then droughts decrease the overall water quality and increase people's desperation and ingestion of unsanitary water and food, and also decrease people's ability to do hand hygiene. So all of these things contribute to people getting more and more waterborne infections. So here's just an image of how this works with Vibrio cholera as an example. So we see heavy precipitation leading to storm surges, sea level rise, warming leads to propagation and survival of the pathogens. We see outbreaks. The flooding causes the latrines to get into the water, and that disperses, and it all becomes kind of a vicious cycle. So as just a few examples of details that we're seeing with these infections. So we have cholera, as I was talking about, is a really severe diarrheal illness, can be fatal. Another one of these diseases that in the Western developed world we think of as like a historical artifact, but actually is a disease that does cause much death worldwide. We see that higher temperatures consistently increase the risk of cholera, and increase the expression of virulence genes, meaning that when people do get cholera, it's worse. Flooding drives outbreaks, and it's currently found in 40 or more countries worldwide. So again, this is not a relic of bygone era. This is something that's still very much out there. Salmonellosis or typhoid causes 90 million cases and 155,000 deaths worldwide. We see that higher temperatures boost transmission and bacterial replication. It also prolongs the transmission season, increases the virulence genes, and increases the risk of disseminated disease. Campylobacter is the most common bacterial cause of gastroenteritis worldwide. This one, the studies are a little bit more hit or miss about whether or not climate change really worsens it. However, shigellosis, which is another bacteria that can cause dysentery and can be very fatal, we see increased runoff leads to groundwater contamination because this is also often transmitted by cattle and other farm animals, and we see increases with increasing risk of temperature. So there's another species of Vibrio vulnifertis and Parahemolyticus, which are related to cholera that can cause slightly different infections. These are bacteria that are found in warm seawater. It can also be acquired from eating undercooked seafood. So we see it a lot with like raw oysters. It can cause necrotizing infections, bloodstream infections, sepsis, and death. It's particularly deadly in people who are immunocompromised or have liver disease. When I was in medical school, this was a disease that we learned about as being found really in like Maryland and in the kind of southeast part. However, we actually are seeing it in Massachusetts now, which would have been unheard of back when I was in medical school. And it's projected to expand all the way up to Maine by 2080. I think it'll be in Maine sooner than 2080 because it's already in Massachusetts, which is not that far. The last of the waterborne infections that I wanted to mention is the brain-eating amoeba, amoebic encephalitis, which is caused by Naegleria fowleri. This is an amoeba that is thermophilic, meaning that it loves the warmth. It lives in freshwater environments. People acquire it by doing different freshwater recreational things, or sometimes by doing nasal irrigation with tap water or swimming in unchlorinated pools. It gets in through the nose and moves directly to the brain, typically rapidly progressive and fatal. We don't have a lot of good treatments for this. It's relatively rare. There's only about 400 reported cases, but it's likely extremely underreported. We know that this is found worldwide. However, 41% of the cases are reported in the United States, which is likely just because we do have better reporting systems than most of the other places where this is found. And so this is actually likely found worldwide at relatively similar rates, just not being underreported, even here, but everywhere but here. So with climate change, we're seeing increasing water temperatures, promoting growth and persistence, prolonged transmission season, northward expansion. This is kind of traditionally something, at least in the United States, that we think of people only really acquiring in the South. However, that can change. And then extreme weather events can increase the dispersal of it. So what can we do about these infections? One key really critical thing is making sure that there's universal access to safe water, strong hand sanitation and hygiene infrastructure worldwide. It's not good enough to just have good sanitation here. We really need good sanitation worldwide to be able to eradicate some of these problems. The kind of key example is like seeing how much cholera there still is out there, even though we've managed to eradicate it here. Having wastewater surveillance, monitoring, and early warning systems can be helpful. So departments of public health can monitor the wastewater for signs of these diseases so that we know about them circulating in the community even before we're catching active cases. Enforcing water quality laws and standards, making sure that public and healthcare workers are well educated about hand hygiene, water sanitation, and these diseases. Ensuring universal access to healthcare, clean vaccination and treatment, water conservation, and again, addressing climate change itself. In terms of mitigation efforts, so kind of taking a step back, I talked about a whole bunch of different diseases that can be worsened by climate change. And that's just a sampling of them. I really could probably go on all day talking about all of the different ways that infections are changed by climate change, but that was just kind of, again, kind of tip of the iceberg. But what can we do about this? Four kind of pillars of interventions are the One Health approach, surveillance and early warning systems, boosting the healthcare workforce, and infrastructure improvements. So the One Health approach, for those who haven't heard of it before, is a collaborative, interdisciplinary, and transdisciplinary framework that recognizes that human, animal, and environmental health are all interconnected, and that there's a global reach of these interconnections. So addressing a problem in one location isn't enough. We need to think about addressing a problem worldwide and how we can do that. We need to optimize health outcomes by integrating surveillance, prevention, and response therapies, and being more proactive in approaching preventative interventions, and considering how the impacts of environmental health and animal health and human health affect each other. Additionally, as I mentioned several times throughout, surveillance systems are key and are a huge gap currently in our armamentarium. So our traditional surveillance systems rely on historical case notification data, meaning that after the fact, the Department of Public Health will hear, oh, somebody had been diagnosed with, West Nile virus here or there, and then, in 2026, they'll publish the list in 2025 of how many people had been affected in any given place, which is helpful, but not as helpful in 2026 as it would have been in 2025. So if we had integrated surveillance and early warning systems, we could increase our capacity to prepare for and respond to infectious diseases. And so what we ideally would do is take our different data sources, so disease surveillance laboratories, healthcare service providers, death records. We would take entomological surveillance, so like surveillance of vector densities, surveillance of vector distribution. We would take our weather surveillance and we would put them all together and integrate that data and think, sharing the information between agencies, where are we anticipating there to be problems? We can also use satellite imaging, geographic information systems to identify patterns to try to predict disease risk, and then try to use more artificial intelligence and machine learning therapies to integrate and analyze this data without greatly increasing the kind of work burden on the system. The idea would be that we would then have an integrated surveillance system where we could do timely implementation of different preventative and control measures. We would be more prepared and have more capacity to adapt as things come up, and that we would be able to do preventative efforts and allocate resources to target at-risk populations and regions, as opposed to just reacting after things have happened. So I mentioned the healthcare workforce is also another key component here. I will admit that perhaps I'm a little bit biased when it comes to this slide, but our healthcare workforce is already very strained. In the United States, there's a projected shortage of 124,000 physicians by 2033. The situation is particularly dire in infectious disease. 80% of counties in the United States do not have a single infectious disease physician. And this problem is only getting worse. People don't want to go to an infectious disease anymore, and actually 40% of fellowship positions were unfilled in 2025. This map over on the right is a map of the mean distance from each census block to an infectious disease physician. So you can see that for most of the country, we're seeing these large swaths of this dark red, which means that people are living over 100 kilometers from an infectious disease physician, which means that this expertise, this knowledge of these different pathogens is just not anywhere to be found. And so climate change is driving these infectious diseases into regions where providers are not used to diagnosing and treating them, and where people don't have the expertise to recognize them, which is a real recipe for disaster. Because where these diagnoses are going to be missed, people are going to die unnecessarily. So the take-home points here, the links between climate change and infectious diseases are complex. Clearly, current changes are increasing the risk of many infections. Kind of just to summarize, with the pathogens, we're seeing that warmer temperatures, poor water quality and sanitation, and porous infrastructure are improving pathogen survival and spread. We're seeing that hosts and vectors are being affected where climate change is affecting the other species of animals, insects, and plants that are part of the pathogenic life cycle and spread. Seeing that water shifts, including warming, extreme weather events, flooding, and droughts, all are driving spread and vulnerability to infectious disease. There's a lack of preparedness worldwide. There's inadequacies in current infrastructure, healthcare systems, science, and mitigation efforts. And there's also increasing inequities, which I know I didn't really get into directly in this talk, but talking about all these diseases that we don't really have here anymore, but are still found prevalently in other parts of the world and have the potential to come back here as a result of our lack of addressing them when they're affecting vulnerable populations only. So this is just a smattering of recent headlines to really illustrate my point that this is a current and pressing problem. These are all headlines from the past 6 months about infections spreading to areas where they didn't used to be found and causing problems, even here in the United States. That is my talk.
Thank you so much, Dr. Bridget. Who has questions? We don't have microphones, so please stand up and yell.
So I'm just interested, you said there were 9 diseases that are better with climate change. What are those diseases?
That's a great question. The question was that there's 9 diseases that are better with climate change and what those are. I don't know off the top of my head. It is true that this is not that the dogma that warmer temperatures don't always drive the survival of pathogens. So there are some pathogens that do thrive at colder temperatures or at higher elevations, for example. And so not every pathogen is worsened. So I think the example that I did have in the talk was Campylobacter. Doesn't seem to be actually affected necessarily one way or the other, even though all these other diarrheal diseases are worsened. I don't actually know the 9 off the top of my head because I don't remember what they are. But it's a great question. I'm definitely going to go look that up when we're done.
Go ahead.
Particularly with Neigleria fowleri, I know it's difficult to kind of catch the cases before they're fatal. Is there anything being done to test the waters so that we can kind of get on top of it there,
And could you repeat?
Yeah. So the question was whether there's anything being done to test water for Neigleria fowleri to try to catch it before people acquire it. That is not something that I'm aware of. I can't say for certain because I don't really know in depth the public health practices in the Southeast United States, which is where it's most prevalent. It's definitely not anything being done in Massachusetts, which makes sense because not a lot of Massachusetts currently. Knowing how underfunded a lot of the public health departments are in the Southeast, I would suspect there's probably not, although I don't want to be casting negative aspersions where they're not deserved, but my guess is no. Yes.
There is something being done by Montana and the USGS, really farmers is doing that about it in the national park. This year, I think that's why that we're in Riverside is closed, but that's pretty much the other farmers. Yeah, it's not really, yeah. Oh, yeah, the USGS is studying. I know it's difficult to.
Marnie, you want to say that up front? Is it worth saying what they're doing?
Yes.
We don't have a microphone. You want to go up front and say that? Thank you.
I was just saying that the USGS is testing for Neigleria fowleri, especially in hot springs, and natural hot springs. They found it in Teton National Park. And I believe that's why Boiling River, which has been a popular swimming hole on our side of the park, has been closed. So it is here, and hot springs are a particular source of concern.
Yep.
And if you want to look up that work, that's Elliot Barnhart.
Perfect. Amazing. Thank you.
Thank you. Sure.
So infectious disease has found itself in the middle of politically charged topics, from HIV to IV drug use infections to COVID-19. This is obviously a politically charged topic. what have you personally or your societies found that you give advice for us who have a
Sorry, so the question was, in infectious disease, we're used to doing a lot of advocacy and dealing with these politically charged issues, and what advice can we give? I mean, it's hard. It's really hard. I mean, I think the thing that seems to work best is being collective. So I know that in infectious diseases, we do a lot of our advocacy through the Infectious Diseases Society of America, and working together as a national group helps us get a lot more done than we would be able to get done on an individual level or even on a state level, especially because a lot of these issues are being dealt with, addressed, whatever, on a national level currently. So I mean, collectivization is important. I think the other thing that's important is just kind of keeping at it, you know, especially when thinking about a lot of the challenges that we face with the HIV epidemic and that we face with the epidemics of people who inject drugs and get injection drug related infections. And there's a lot of failures. And there's a lot of, you know, trying to get something done, failing to get something done, kind of going back to the drawing board, seeing how